Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Patient-Centered Outcomes Research Institute. That's what PCORI stands for. Hi, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. I wanted to make this video because of because this is a special program that is specifically geared towards focusing on dissemination and implementation. And so this sort of activity is especially important because once you conduct research, then what? And what do you do with that research? I mean, most research just kind of dwindles away, doesn't see the light of day, doesn't get published. So it's important for us to look for ways to disseminate. These are some funding opportunities that are available through PCORI currently at the time of this recording. And then these are examples of implementation projects that were PCORI funded. And I'm going to read from the one on the left, and this was helping clinicians identify and report possible abuse in children through an emergency department child abuse alert system. So, as you can see, this is about understanding ways that you can implement research that may have shown things about child abuse. So moving onward, expanding a shared decision-making program for patients considering LVAD treatment. And so this is kind of, if you wanted to take a little bit more of a look at what is going on with this, these are looking at some of these LVAD clinics and making sure that there's a shared decision-making program in the LVAD. And for those of you that may not know what LVAD is, it's actually a treatment, a newer treatment for heart failure, and it's known as the left ventricular assist device. And so what it does is it's a little device that it's installed, and it helps to pump better by the left ventricle. Some people say they feel 10 years younger with this left ventricular assistant device. So this is another example where PCORI funded research study helped to determine if shared decision making helps patients select treatments and make better choices based on what's important to them. So going back to some of these examples, the third one on the right was looking at some ENT infections in children and antibiotic prescribing practices, especially looking at antibiotic stewardship and ensuring that multiple health systems are improving the prescribing practices and not creating resistance, antibiotic resistance. Stewardship is something that is a term that is used for many different types of antibiotics, but both broad spectrum and narrow spectrum antibiotics need to be part of the program, part of the prescribing antibiotics for respiratory tract infections program. And so this project is using a multi-part program to improve antibiotic prescribing at healthcare visits. So not all ENT infections need antibiotics. When to use, not to overuse broad spectrum antibiotics. To use narrow spectrum antibiotics when possible. These are practicing principles that are oftentimes needed and are many times neglected. So this project is actually was participated by 115 sites, and so it created a 30-minute online modules to teach clinicians about appropriate prescribing and communicating with parents. So as you can see, it doesn't have to be long, doesn't have to be drawn out, but you can create automated training modules and materials to help clinicians understand or improve their skills in whatever area that may be. And this is, again, an example of PCORI funding. So those were the three examples. There's some additional examples that you can go into where outcomes-based matching of patients to mental health was provided. So pairing patients with therapists based on patients' primary mental health concerns and therapist strengths showed better outcomes than if that matching was not conducted. Another interesting, so I can click on this one, implementing the infusion clinic model in sickle cell disease. I've actually extensively in multiple cities worked with sickle cell patients, and I've seen patients with sickle cell and the crises they go through, and having to go to the ER, especially during adolescent years. It's very difficult to deal with. And then also having to manage the pain through proper pain management is another concern. So this is just talking about the infusion clinic, because infusions are many times needed. This is going into improving some of the circumstances during the infusion. So there were 483 subjects enrolled in the trial. Over the study period, within 4 sites, there were 3,000 acute care visits, 1,500 ED visits, 1,400 intensive care visits, which goes to show the type of disease this is. And so basically, the patients who received care at an IC, the overall mean satisfaction score is measured was 5.8, whereas in the ED was 4.8. So it seems like the emergency department visits are not very comfortable for individuals with sickle cell disease. So anyway, this is another example of a wonderful implementation project. Implementation strategies to enhance use of conservative management of urinary incontinence in women. So urinary incontinence, especially after pregnancy, is so common and becomes somewhat of an issue if it's and of course if it's you have stress incontinence, you have urge incontinence. So with stress incontinence, with sneezing, or with any sort of pressure, there might be some release of urine. So there's different types, but what's important here is that the PCORI funded research was used in order to provide evidence-based first-line treatment for urinary incontinence in women aged 60 years and older. So this was something that was kind of tailored, putting a virtual program that provides screening, treatment, and referrals as needed. And so this was kind of an automated system, which made it made the rapid kind of flow and turnaround of patients with urinary incontinence. This can be an embarrassing problem, something that requires kind of a team approach to better understand. So partnerships especially are important. And of course, there's many barriers to treating urinary incontinence, requiring innovative solutions to reach women who are negatively affected by this type of leakage. So the ability to, this is an interesting statement, reach and treat many women who are adversely affected by bladder leakage but do not seek or receive care has the potential to improve quality of life for millions of women. So this really did go into some of those barriers and understanding how to manage with brief interventions treatments, which was again a kind of a non-surgical sort of automated system and referrals. So this goes into some more of these questions about, again, this goes into urinary incontinence even more. So these are all the different projects that are available under PCORI, PCORI funded. You can actually explore all of these tabs above. You can go into About and look at some of their work and about what drives them, basically what we do. They're an independent nonprofit research organization that seeks to empower patients and others with actionable information about their health and healthcare choices. So they fund like comparative clinical effectiveness research, which compares two or more medical treatments, services, or health practices to help patients and other stakeholders make better informed decisions. I'm just reading this out, but where I wanted to emphasize it here is that they are emphasizing on comparing, and this is different than really public health, comparing two or more medical treatments, services, or health practices. So this is where it's where there's some overlap, but looking at the service part of it and the practice part of it more so than anything else. And there's several times a year there's always funding available, and so you should keep looking out for this. There's been $3 billion that's been awarded. $3 billion. I'm going to repeat that. $3 billion that's been awarded since in the last 10 years. About 2,000 research and related projects. And they have a vast portfolio of all the types of medical journals and all the types of research that have been funded. And so if you want to apply for something in the future, there's 1,992 results that you can go through to see what gets accepted. And so this is honestly a really, really, really good opportunity. And of course, you can narrow down your search options by health condition. If you want to just look at lupus, there's only two and and so you can narrow it down like that. But as you can see, the opportunities here are vast for not only database exploration, but also applying for different types of funding opportunities throughout. So this is interesting. Two of these project status in progress, expanding use of decision aid to help people with lupus nephritis make decisions about treatment. And then the second one is a personalized decision aid to help women with lupus nephritis from racially and ethnically diverse backgrounds make decisions about taking immune blocking medicines. So this is sounding really interesting because what it's looking at is some of the immune blocking biologics, I believe, and how decision making takes place and how that may vary by ethnicity. And of course, lupus nephritis is an important byproduct, should I say, or an outcome of the condition lupus. It's a chronic condition where you get flares from time to time, and so the research team made an online decision aid for women with lupus nephritis. So they can then use this decision aid when they're choosing between two or more treatments. So this was tailored with information in the decision aid to specific ethnic groups and current treatments, and also in different languages. So the team looked at how well the decision aid worked for women of different races and ethnic groups. And so it's read like a pamphlet, and they recruited about 301 women into this study to understand about the decision aid and treatment for lupus nephritis. And the demographic of the patient percentage was 47% for African Americans, 26% for Hispanics, 15% white, 7% Asian, 5% others. So the main limitation was that there weren't enough Asian women in the study to see how the decision aid would work. But doctors' offices may want to use the decision aid. This was the year it completed, 2018. So here are some of there's actually a video here about the decision aid, which I can try to quickly take a look at.
This is
I'm not sure if you're able to hear that, but this is going into a lot more detail about lupus and how there was this decision aid that was made for different groups. And so you can take a look at other parts of this research report as well. This is not the only portion of this. And I think this is kind of a related sort of document right here, but the final research report is in here, and so this is where all of the details are. So if you are trying to write up a report for PCORI and you don't know what to include. This is all of the details that are usually included. And so this is looking at a decision aid that was created, and I'm kind of going into, again, the details. But this is the actual screenshot for the decision aid. And this is what I really wanted to pull up and show you how it looks. And as you can see, there's a lot of different visuals, a lot of different wording and terminology, which helps to show people that are trying to understand what lupus is, how many people it affects, and also the fact that, when kidneys don't work well, the condition is called kidney failure. When kidneys fail, your body retains too much fluid. If kidney failure is severe, you may need to be admitted to the hospital, and if in very severe cases, you may need dialysis. So here's a screenshot of lupus nephritis decision aid, again, using Cellcept, Cytoxan, and then increasing your chance of getting shingles. How many people got shingles? That was also there. I think there could have been a little bit more information on shingles. They do go into that a little bit here. And so this goes on and on. There's not too many though. There's actually only 10 or 11, 12 slides on this. So it's a pretty quick decision aid to go through. And then they kind of ran some of the numbers. And I believe at the beginning we saw that they said that they did see effectiveness in reducing the decisional conflict regarding choosing immunosuppressive drugs in an ethnically and socioeconomically diverse sample of women with lupus nephritis. So as you can see, this is really something that can provide good insight. As, the demographics are here, and you can see reduction in decisional conflict right here. I believe these are reported means. Yeah, I think they're reported means. And you can see the statistical test that was run probably at the end of the report. But yeah, so this sums up a PCORI abstract, a whole a report. What are all the different types of potential proposals that are possible, and just everything that there is to know about patient-centered outcomes. Thank you for listening.